Well, good afternoon. Thank you for joining us for what has evolved into a Friday afternoon custom and an opportunity to update the community on where we stand with the COVID-19 pandemic response. I'll provide a few updates and then turn it over to Dr. Patrick McGough, Executive Director of the Oklahoma City County Health Department, and then we'll be happy to take questions. Today represents a month since the first major efforts began in Oklahoma City to halt the spread of this deadly virus. Last week, I provided a bit of a scoreboard on how we were doing. My overall characterization from last week still stands. By comparison to a normal virus, this is not going well. By comparison to what COVID-19 is capable of, it is going okay. And you, the people of Oklahoma City, deserve the credit for that. To expand on those thoughts, even with social distancing measures in place, unlike anything we have seen since 1918, COVID-19 has moved swiftly through our city and exacted a heavy toll. In the last week, 14 residents of the Oklahoma City Metro have died from COVID-19. That brings the total to 46. We send our deepest condolences to all the families of those who have been lost. Our cumulative total of cases is now up to 895 for the OKC Metro. Having said that, in comparison to what COVID-19 has done to other cities near and far, the numbers are encouraging. Our new cases have ranged between 20 and 40 every day for the last 8. Our new case numbers each day are not declining, but they do seem to be at some sort of plateau. And it is in deaths where we really can see the difference between our experience and other cities. In the OKC Metro, per 100,000 residents, we have lost 3 lives to COVID-19. So that's 3 lives lost for every 100,000 people who live here in the city. In comparison, per 100,000 residents in New York City, 138 residents have died. And though New York has much higher density than Oklahoma City, other places with a more typical density have also suffered similar fates. For every 100,000 residents in the Lombardy region of Italy, 116 residents have died. For every 100,000 residents in Detroit, 77 have died. For every 100,000 residents in New Orleans, 54 have died. COVID-19 is capable of killing people in numbers we have not seen since the Spanish flu, and it is capable of doing it in cities with incredible density like New York, and in cities with medium density like Detroit and New Orleans. And just like the Spanish flu killed 7,000 Oklahomans a century ago, this virus is capable of killing people right here in Oklahoma City. But your hard work at social distancing and sheltering in place has kept its worst outcomes at bay. This is something for which we should be proud, and I am certainly proud of you. And it is also worth noting we have thus far flattened the curve so that our healthcare system can handle it. With this as our track record so far, we are beginning to look to the future cautiously and thoughtfully. The most sobering reality we are all confronting is this: COVID-19 has no vaccine and no proven treatment. We may live in its shadow for many, many months. So how do we move forward? There are multiple layers to this. One is the national response, one is the individual response, and one is the state and local response. It is always worth noting we do not operate in a vacuum here in OKC. We depend on national resources and we depend on national guidance. We are not likely to dramatically deviate from nationally recognized tactics. Nationally, everyone is talking about the next phase, and so are we. Many speak of it as a dimmer, not a light switch. A return to some normalcy must be gradual and thoughtful and respectful of the fact that this virus isn't going anywhere. At the national level, there is also now a widespread consensus that we must ramp up our efforts to test, trace, and quarantine. Get ready to hear that phrase a lot in the months ahead. We do that work here in Oklahoma already, but we will need national support to ramp up to the levels necessary for you to feel comfortable that you are not walking into an outbreak every time you leave your house. This week, I joined Los Angeles Mayor Eric Garcetti and former Bush administration public health official Dr. Mark McClellan in calling for the creation of a CARES Corps to give that support to our state and local public health officials. Our joint op-ed to that effect was published yesterday by CNN, and you can find it linked at my Facebook and Twitter accounts. This kind of effort is critical to restarting our economy because the reality is government regulations can be rolled back, but that's not going to restart the economy if people don't feel safe. When it comes to their personal safety, people are smarter than governors and mayors. No matter what the proclamations say, people are not going to go out knowing that there is still a deadly virus without a vaccine or a cure working its way through our city, unless there is a robust network that is testing, tracing, and quarantining. The prospect of a return to normal is intoxicating. I want it more than you, but I can't deliver it with a proclamation. Having said that, state and local governments do play a role in the next phase. The existing state and local proclamations expire at the end of April, as April 30th was a date recommended by President Trump, and we followed that recommendation at the state and local levels. Now we're talking about what May looks like, and we're doing so collaboratively. On Wednesday, Governor Stitt, Mayor Bynum of Tulsa, and I got on the phone and started that conversation. Last night, President Trump shared guidance that will certainly figure into that discussion as well. In summary, President Trump's explicit request is that Oklahoma City not move into a multi-phase reopening until there is a 14-day period where symptoms are declining, as well as a 14-day period where cases or positive test result rates are declining, as well as confidence that our hospitals can handle the situation, as well as a robust testing program for healthcare workers. At first blush, I find President Trump's standards to be worth serious consideration, and I have asked my public health advisory group, led by Dr. McGough, to analyze them in detail. President Trump's recommendations, the advice of public health officials, especially here in Oklahoma City, and the conversations we will have with Governor Stitt and Mayor Bynum will all inform the path forward, and we will have plans in place prior to April 30th. We will continue to prioritize life, and we will continue to rely on basic principles of science. In the meantime, this virus is still working its way through our city. We are right in the middle of this fight, and we need you to do your part. Please continue to shelter in place and prioritize your life and the lives of those you love. And per CDC recommendations, please wear a mask when in public settings where social distancing is more difficult. As I stand here today, we know for a fact that there are hundreds of people in this city with COVID-19 who can transmit the virus right now to everyone they encounter. We can assume there are probably many hundreds, if not thousands more, who have the virus but have not yet tested positive. This situation, as stable as it may seem today, can turn on a dime if we're not careful. This week, I read a powerful interview with Dr. Zachary Blankenship, who grew up here in the OKC Metro, but is now an ER doc in New York City. His message to Oklahomans was this. He asked that Oklahomans please not downplay the virus. He said, quote, "This has been one of my big frustrations. Maybe this is some sort of denial. Maybe people are trying to protect themselves because they don't want to face that. Downplaying it doesn't just hurt you, it hurts everybody you've come into contact with. It hurts people who are older than you. It hurts people who are baseline sicker than you. I think it's selfish," end quote. He went on to say, quote, "Please think about how your individual actions are affecting others. Think about what you can do to make the situation better. And I know everyone's heard it a million times, but please stay home. I don't want to be too negative, but I have just seen so many people die in the last week. I've seen people who are so sick, and we're doing everything we possibly can, and they still die. My friends in Oklahoma, they just don't get it. I think that, I don't know, maybe the news somehow isn't real enough to people. So maybe if they hear my voice, then maybe it'll become real for them." It is certainly real for those of us who have the burden of making these decisions. So far, we know that thousands of lives have been saved, and not really because of a proclamation, but because each of you responded. From pastors to business owners to restaurateurs to average residents, you have done the hard work. You have stayed home and you have saved thousands of lives. The road ahead is going to be long. And as we potentially emerge into a new phase, I have confidence that you, the people of Oklahoma City, are up to the task. This past month has conditioned all of us. Whatever rules are in place, I have confidence that the vast majority of you are going to take this situation seriously. Let me conclude with a few words about the important anniversary we mark this weekend. It is not how we expected to commemorate the 25th anniversary of the Oklahoma City bombing, but the anniversary is no less important and no less meaningful. I encourage you to join me for the very special program that will air on all stations Sunday morning at 9 a.m. We rightfully look back with pride on how we responded to the bombing. We took care of the rescue workers. We took care of the victims' families and survivors. We took care of each other. We call that the Oklahoma Standard. There was another layer of response that sometimes we don't talk as much about, and that's the effort we embarked upon to rebuild our city. Ultimately, we didn't just put things back the way they were. We built a much better city out of the ashes. I can't help but notice the coincidence that the first maps passed just a year before the bombing. Its investments rolled out afterwards and helped this city recover. Now we have MAPS 4 and its $1 billion in stimulus to look forward to after COVID-19. We entered the COVID-19 pandemic as one of the most optimistic cities in the nation. When we do exit the COVID-19 pandemic, and we will, we should exit it with the same optimism, knowing that we have done this before. That's another legacy of the bombing aftermath from which I will draw inspiration in the months and years ahead. The COVID-19 pandemic will be with us at some level for some time, but we know the seeds of recovery have already been planted, and we know that we can get through this crisis as we did 25 years ago and as we have so many times before. As always, I want to thank all the people on the front lines of the COVID-19 response. Of course, public officials are near the top of that list, and let me bring to the stage one of the finest in the country, Dr. Patrick McGough, Executive Director of the Oklahoma City County Health Department.
Thank you, Mayor Holt. Cautious optimism. As conversations ramp up nationally and across our state around the potential to reopen our society, I want to express how we should all approach these next few weeks. With cautious optimism, responsibly focused on safety for you and the ones you love. The continued spread of the virus in our community will not just stop overnight. As we've all heard Dr. Fauci say, this is not a switch, a light switch that you just turn off and on, but it's a dimmer. Scaling back the safeguards currently in place can only be done successfully with strong local public health mitigations, which you are a large part of and have done very successfully. One mitigation strategy is the ability for public health to meticulously perform contact tracing investigations and work toward identifying any future outbreaks. Another mitigation strategy will be widespread testing of all individuals in our community. While the Oklahoma City County Health Department's testing site has now tested more than 2,400 individuals in the past few weeks, ongoing widespread testing must be in place to identify potential outbreaks and slow the spread of positive cases. I applaud Mayor Holt for embracing, and I do mean fully embracing, a public health approach to any plans toward reopening. I also appreciate Governor Stitt for the plan designed to handle potentially overwhelming hospital surges, which hopefully will never be needed. Here in Oklahoma County, we are quickly designing a dashboard that will reflect the measurements outlined in the White House guidelines for reopening. This dashboard will give Mayor Holt and other mayors in central Oklahoma the information and data they need as they choose to consider and as they look toward reopening. We remain cautiously optimistic as hospitalizations continue trending down from the highs experienced just 2 weeks ago. Once society begins to reopen, it is my hope that we all continue the best practices we all know help and prevent the spread of COVID-19. Our personal hygiene and social distancing efforts will continue to be the strongest tools we all have toward protecting ourselves and our loved ones. Please continue wearing masks when you are out in the public. Please continue washing your hands as much as possible throughout your day. Individuals who are 65 and older and individuals who are immunocompromised must remain vigilant and continue to isolate at home as much as possible. We are cautiously optimistic as we're starting to see a small glimmer of hope here in central Oklahoma as our case numbers and deaths appear to be flattening. Again, that is relative to the availability of widespread testing. And again, now is not the time to throw caution to the wind. We cannot go back to life as what was considered normal just a few short months ago. Regardless of how quickly or prolonged reopening looks like for our community, we must all get used to a new norm. The absence of a cure or a vaccine could see us continuing some type of social distancing for months in the future. But we must continue to protect ourselves and our loved ones. In the meantime, your local public health stands ready to protect you, the public, and we thank you very much for all that you have done in social distancing, in wearing your mask, in washing your hands, and in being diligent with planning your day before you go out for necessary things such as grocery shopping and for pharmaceuticals. Thank you again very much, and I want to thank our mayor, and I want to thank our Oklahoma City County Health Board, and I also want to thank all the employees here in Oklahoma City County Health Department. And with that, I think we're ready for questions.
Yes, we are. First on our list, and we'll go down the list, I have KOCO. If you'll tell us who the question is, and then proceed to give us the question.
Hey, this is for the mayor. It's Dylan Richards with KOCO. My question is, the governor talked today kind of about his starting to formulate his plans for reopening. Do you feel good about your communication with the governor's office, and do you expect that we'll do similar things, follow a similar timeline to the state government, or could we see different action within the city from what the state is doing?
Yeah, thank you. I have every reason to believe, based on our conversations this week, that we'll collaborate. There's still 2 weeks till the end of the month, and so there's plenty of time. And I think that we'll collaborate on what the next phase looks like. And I have no reason to think today that we'll seek different outcomes. Obviously, we're very interested right now in what came out in the last 24 hours from the White House, and the governor alluded to that in his remarks today as well. So I'm sure that will be a part of the conversation as well. But I have every reason to think we can align. We shall see, I guess, in the days ahead. But the White House plan was very thoughtful and seemed like a good approach. So I hope that that's something maybe we can start our discussions around.
All right, next on our list is the Journal Record. If you have a question, specify who and ask the question. Journal Record, are you there? Okay. Let's do Brett with the Oklahoma City Free Press. You have a question, Brett? Oklahoma City Free Press, are you online?
Yeah, you can just move on,
Okay. We have Bill Crum with the Oklahoman. Bill, are you online? Bill Crum, are you there? Yes, go ahead, please.
Ken, I'm actually on furlough this week, so I'm on my own time. And Tim Willard from the Oklahoman is online, I think, in official capacity.
Sure.
Otherwise, I'm just killing a good afternoon.
Okay. Tim, what's your question and for whom? Okay, well, let's go back to the Free Press again. Brett, are you there, and are you unmuted? And Give us a question, please.
Yes, Ken, thanks. I'm sorry, it was my fault. Mayor, we keep getting questions from some of our readers about this. Mayor, if you want to weigh in on this, that's fine, but also I want to hear from Dr. McGuff about this also, about the data sets that are being used for the chart that seems like the Oklahoma State Department of Health is using.
More like you.
This chart was put out showing the flattening of the curve, which is kind of the predicate for everything else that's going on here from the governor's office policy-wise. And so, we have readers who continue to ask where that data is coming from. There are no references to any kind of data or any kind of models on that, and I'm just wondering where exactly that information is coming from. If that's the predicate for all other policy, shouldn't we know where those models are coming from and where that data is coming from?
Hi, this is Dr. Mack, and thank you for that question. And I think those are really good remarks and questions. First of all, I want to say that I'm not speaking for the Oklahoma State Department of Health, so I can't really attest to all that you're asking about. But I will tell you what we need to be looking at as we go into this process is the total number of new cases, or just new cases in general. And we need to see that number is staying the same or going down consistently for at least 14 days. I think I'm guessing, extrapolating, that probably the State Health Department is certainly looking at those. I know for a fact that the governor's task force, which seems to have done a great job on preparing the hospitals for surge capacity, they're looking, the curve that you see that's put out so frequently about that was expected surges versus what's actually happened. And on that bottom line, the lower line, it kind of shows where the hospitalization surge never hit what was anticipated. However, I listened to the governor's conference just prior to this conference, and he continues to reflect the fact that they are well prepared in the event that a surge does happen. So I know the hospital surge capacity is being looked at, and I know that the daily deaths, daily case totals, those are all things that we can look at. I think the point maybe that your readers are questioning is our ability to really know the total number of cases that are in the state of Oklahoma. And so sometimes those cases are not truly reflective of of what is going on. Just like when we widened our ability to test, then we also started seeing lots of positive cases. And of course, that's going to continue to be the thing. And then if you had a hotspot or an area where a lot of people were being tested and there's a small outbreak in that area, it can disproportionately reflect that the numbers are really growing up across the board when they're actually not. So there are a lot of pieces of information that have to be looked at in consideration. And so I'm assuming the state, they're looking at all of those kinds of things. Here at Oklahoma City County Health Department, we are going to be looking at, with this new dashboard that we're creating to advise the Mayor's Public Health Advisory Group, will include things like the daily deaths, the total number of cases. We'll be looking at our county as well as the state's counts, and we'll be looking at hospitalizations. And so I think the big key terms, again, to follow what the mayor was saying, testing and tracing are key as we go forward, and you will be hearing more and more about those two terms. And I hope that answers your question. Thank you.
All right, let's go to News 9. We have a reporter online. Who do we have, and your question to whom?
Hi, this is Kaylee. My question, I suppose, would be for the mayor, kind of in line with what Dylan said. Can you give our viewers a little bit more of a hint of when we're going to get that May plan, when that would possibly come out, and is it going to be in line with the state? And then the second question is if you could just elaborate on the CARE Corps and that op-ed that you wrote, and how you're hoping to see this come to fruition.
Yeah, so your first question was about timing of our plan for what May looks like. You know, we're 2 weeks out from May. I would like to be able to give the people of Oklahoma City some notice, you know. Obviously, in the early stages of this, it was kind of impossible, and things were happening very quickly and very suddenly, and I think it would be nice for folks to have a little bit of warning. So, you know, we've got 2 weeks. I would love to work hard over the next, 7 to 10 days and have something to produce earlier than April 30th. And you asked if it, again, if it can be aligned with what the state's doing. My hope is that it is in perfect alignment. Let's just see how that works out, but we're all trying to work towards that end, I think, this time. So we shall see how that goes. But it is certainly our goal to have something, to present a few days probably before May arrives, to give a picture of what the next phase looks like. You asked about the CARES Corps. This is a national concept. Dr. Mark McClellan is part of a group who's been working with also with former Trump public health official Scott Gottlieb, and has been laying out some really good national proposals that anybody can find. If they Google it, they could Google or look for our op-ed as a first entry point, but there's lots of great reports out there that kind of outline what all this looks like. The main goal being to test, trace, and quarantine at high enough levels that the public has a comfort level leaving their houses, even in the face of a virus that still has no vaccine and no treatment. The tactic to get to that goal, partially, is the proposal for a CARES Corps. And Mayor Garcetti and I and Dr. McClellan wrote that jointly to show the national and bipartisan reach of the idea. Ultimately, that's not something we can execute, obviously, unilaterally here in Oklahoma City. So we will certainly do everything we can at the state and local levels to ramp up our testing and our tracing. But what we're really asking for is, a national effort that would hopefully start soon and last into the months ahead. I know that, it's getting some traction. We'll see how that goes. I lent my voice to it, but I'm not in Congress and I'm not the president. So, there's only so much ultimately we can do here at the local level. But I did want to, I was certainly supportive of the idea, and I wanted to highlight it today. Thank you.
All right, we have Fox 25 on standing by. Who would you like to direct your question to and ask the question?
Hi, Dan Snyder from Fox 25 here. Mayor, what would you say to some of the protesters who were out at the Capitol early this week? They're getting restless. They're saying it's time to go back to work. How would you respond to them?
I know very little about that. I saw some images, though. I saw a group that got out of their cars and bunched up really closely to show how much they didn't fear this deadly virus. And I guess what I would say to that is, when I see images like that, I think of the healthcare professionals on the front lines who are going out every day, in some cases leaving their families for weeks at a time and putting their lives on the line and putting themselves in danger to take care of strangers. And those people are going to get sick, especially if that behavior reflects their daily activity. And I know that those brave and courageous public health professionals who are actually brave and are actually courageous are going to take care of those people just the same. And I hope that weighs heavy on their heart when they do that kind of thing. People are getting sick, and people are dying, and people on the front lines are sacrificing everything for us. And we should sacrifice just a little for them.